The CDC explained its decision Wednesday to cut its COVID-19 isolation guidelines in half from 10 days to 5. Agency Director Dr. Rochelle Walensky said the choice was made partly in an attempt to ensure hospitals and facilities are adequately staffed to handle new waves of infections. Federal health officials also say a negative test at the end of that 5-day period is not necessary. The move has garnered a lot of criticism as the country deals with a dramatic increase in cases driven by the Omicron variant. Hospitalizations are also up among children. More than 53 million Americans have been infected with coronavirus since the pandemic began. Over 822,000 people have died. CBS News correspondent Nikki Batiste reports.
As Omicron cases skyrocket, more kids are falling ill.
Our numbers are rising, and I'm not sure that we've seen the worst of that yet.
Already across the country, the average number of currently hospitalized kids with confirmed or suspected COVID is up 74% in the past month. In 13 states, the number of children hospitalized with COVID has more than doubled. Much of that jump has taken place during the holidays.
How are you and your colleagues feeling as kids get ready to go back to school next week?
Yeah, I think we're bracing for having a very busy January.
The good news is that scientists say the data so far shows Omicron is causing milder symptoms in children than the Delta variant. And New York officials say that every child between 5 and 11 years old recently hospitalized with COVID was not fully vaccinated.
I really do hope that parents understand that the best thing they can do to protect their children from severe illness is to get them vaccinated.
Also today, an explanation from the CDC director on why the agency's new guidelines of a shortened isolation period following a COVID infection did not call for getting a negative test.
We did not include a testing requirement in isolation because we were not clear. It was not clear what we would do with the information when we had it, and because the FDA has not authorized that antigen test for that use.
Happy New Year!
In Times Square, preparations are still underway for New Year's Eve, and nationwide there's a similar dilemma.
For families with unvaccinated children, children too young to be vaccinated who want to celebrate the new year and get together with friends and family, what's your advice?
With this particular variant, this Omicron variant, it is much more contagious, so it makes those things a little bit more challenging to do safely, especially in an indoor space.
And here in New York tonight, there's an even greater push to protect children from COVID. The state reported nearly 70,000 new positive tests in just the past 24 hours. That's a 65% increase in one day. And Elise, that's a new record.
So high. Nikki Batiste, thank you. For more, we want to bring in Dr. Shikha Jain. She's an assistant professor of medicine at the University of Illinois, Chicago. Dr. Jain, thank you so much for joining us. The CDC says its decision to shorten the COVID-19 isolation period was done to ensure hospitals could stay open and staffed. And studies show that most people are most infectious 1 to 2 days before symptoms develop and 2 to 3 after that. What do you make of these revised guidelines?
Thanks so much for having me, Elise. So I will tell you there have been a lot of discussions among healthcare workers and on social media over the last 24 hours with these new guidelines that have come out. I think it's great that we're able to use science to start moving towards shorter isolation and quarantine periods if the science supports that. I think one of the challenges a lot of us are having is that there is no requirement for a test at that 5-day period, because we know that it is possible for people with COVID-19 to still be infectious after that 5-day period. And also a lot of the data that's been reported is not including the Omicron variant, which is much more contagious. The other thing that has not been emphasized as much that I think really needs to be emphasized is wearing that mask for the 5 days after you exit your isolation period needs to be a really good mask. So an N95 or a KN95 or a KF94. So it needs to be a really good, effective mask, because those cloth masks that we know do not work as well against the Omicron variant. If you are still infectious from COVID-19 after that first 5 days, even if you're not having symptoms, we want to make sure you're wearing a good mask so you're not spreading the virus around.
Absolutely. The FDA says some antigen tests may have reduced sensitivity for detecting the Omicron variant that you just discussed. What does this mean for testing going forward?
Well, it's a great question. And I think we'll learn more as we do more studies on the Omicron variant and the testing. I want to remind people that a lot of people who are getting COVID right now, who are having mild symptoms, are those people who are vaccinated. So it is possible that they may not have as much viral load in their nose when they do the testing, because the vaccines are doing what they're supposed to be doing, which is decreasing the viral load and making sure people don't get as sick. So that might be one reason why some of these antigen tests aren't picking up the new COVID infections that we're seeing. Another possibility is that as we see new variants, it's possible that variants may be able to get around those antigen tests. We don't know if that's the case with the Omicron variant yet, but we'll learn more as more studies are done. What I want to emphasize to people on this point is if you have a positive test, whether it's a rapid positive test or a PCR test, you are positive for COVID and treat yourself as such. If you are having symptoms, and especially if you've been exposed, if you don't have access to a test, or if the test is inconclusive, you need to assume that you have COVID and behave as if you have COVID, because we are seeing it everywhere right now.
The cases are just so high in abundance across the country. Now, the Biden administration has admitted missteps in failing to secure more access to testing. But in much of Europe, cheap or free testing is widely available. Has that translated into lower transmission or infection rates?
So it hasn't necessarily 100% translated to lower infection rates, but I do think it has had an impact because it allows for easier contact tracing and it allows people to be better at isolating and quarantining. You have to remember, Europe had different vaccines than we did. The majority of the vaccines that were in Europe were the AstraZeneca vaccine. So we can't directly extrapolate what we're seeing in Europe from what we were seeing with positive tests as here in the United States. So I want to remind people that yes, the more tests does absolutely help, because it helps people quarantine, it helps people isolate, and it helps us get a better idea of where the virus is circulating and how to control things. But again, we can't directly correlate and extrapolate that data because the vaccines that are being used in Europe are a little bit different than the vaccines that are predominantly being used in the United States.
Dr. Jain, I want to shift gears just a little bit. The FDA approved the drug fluvoxamine back in 1994 to treat anxiety, panic attacks, and depression. Tell us more about this drug and how it may be possibly used to combat COVID-19.
So this is a type of drug that's called an SSRI. And basically what it does is it decreases the inflammation, which is different from some of the other drugs that we've talked about, which actually decrease the viral multiplication. So the good thing about this drug is there have been small studies that have shown that the decreasing inflammation caused by taking this drug may be of some benefit with COVID-19 and preventing those really severe symptoms. Now, we need larger studies to really get a better idea as to whether this drug could be a game changer. I don't think it's as impactful as some of the other drugs that we have out there now that we know decrease the actual replication of the virus. But it is an interesting theory that this drug may actually help people become a little bit less sick if they take this particular drug that's been around for a long time.
You've mentioned quite a few times just in our brief chat that there's so many things that we don't know. As a doctor, how does that make you feel when you're trying to navigate this pandemic and everything is changing rapidly like this?
So I will tell you, in science and medicine in general, we have learned how to adapt and pivot. And that's one of the great things about science and scientific discovery. Things we didn't know a year ago, we know now. And that results in us changing the way we practice medicine, how we diagnose people, how we treat people. So it's actually a really great thing that things have changed and we learn more. Now, COVID-19 has changed the game a little bit because things are changing more rapidly than they typically do with scientific discovery. And it's by the amazing scientists that have been doing such great work that we were able to get a vaccine so quickly that is so effective. So while it can be scary, especially if you're not directly in the healthcare field, to see how quickly things change, I want people to know that when it comes to science and medicine, this is par for the course. We see things change as we learn more. And as we learn more, we have better treatments and better prevention, which is why we are now telling people that they need to be wearing better masks when they're outdoors. It's why we're telling people we know the vaccines work. It's why we're telling people that they need to stay distanced and wash their hands and keep each other safe, because we know much more now than we did 2 years ago. And we're able to advise and guide people using science and evidence based on new data and new information.
Well, Dr. Shikha Jain, thank you so much for joining us and giving us your advice on how to stay safe.
Thanks so much for having me.